Thinking. The presenting parts of the appendix are it has base, it has body, and it has tip. And the peritoneal covering of appendix is mesoappendix. So base is attached to the posterior wall of cecum, about 2 centimeters below ileocecal junction. As you can see here, this is the ileocecal junction. If you measure, usually it is 2 centimeters below the ileocecal junction. This whole thing is body, which is narrow, tubular, and it contains canal or passage. We have seen in the previous cecum lecture just now. It is opening into the cecum. Valve of Gerlach, I said, isn't it? See, this is the appendix opening into the cecum, isn't it? And this appendix is opening via a valve which is called as valve of Gerlach. So this is the tip of appendix, which is least vascular. Least vascular in the sense we do not have much blood supply over here, and we have various positions of the tips. So what are the various positions? Positions of appendix can be 3 marks or 5 marks question. So what are the various positions we have? Below cecum, you call it as subcecal. Okay, and if it is moving towards spleen, you call it as splenic position. Okay, which can be also called as 2 o'clock position. We have promontory is the promontory of sacrum bone. So if it is pointing towards sacrum bone, you call it as promontoric or 3 o'clock position. So if it is moving towards pelvic cavity, you call it as pelvic position or 4 o'clock position. So if it is moving towards the inguinal point, that is mid-inguinal or 6 o'clock position. Ectopic means, like, other than these positions, usually we call it as ectopic. Okay, so positions of appendix is also a very important question. Okay, so subcecal is below cecum, it is 11 o'clock position. 2% of the appendices we usually see in the subcecal position. Okay, retrocecal is behind the cecum. Okay, splenic I told you towards the spleen. Promontoric is like 3 o'clock, which is towards the promontory. 4 o'clock is towards pelvic region. Okay, mid-inguinal is 6 o'clock position. Ectopic is due to error of rotation of gut that we will see in embryology. Okay, now mesoappendix. What is mesoappendix? Peritoneal covering of appendix is called mesoappendix. Okay, so we will see appendicular vessels are entering here. Then blood supply. So like I told you, for cecum we have anterior and posterior cecal vessels. Similarly, coming from ileocholic artery. Similarly, for appendix also, coming from ileocholic artery, we have appendicular blood vessels. Okay. So these are appendicular vessels which are running in the mesoappendix. Venous drainage, it moves, appendicular vein goes into portal vein. Lymphatic drainage goes to superior mesenteric group of lymph nodes. Nerve supply, superior mesenteric plexus. Now, the most common clinical condition we encounter with appendix is appendicitis, inflammation of appendix. What is the surgery done? Appendectomy, removal of appendix. Okay, so appendix is the most popular surgery which is done by surgeons for any pain in this McBurney's point. Is the most commonly done surgery with the surgeons. Okay, appendectomy in progress, how it is exposed. Nowadays we have laparoscopic surgeries where only a small incision is given in the right iliac fossa, and that appendix is identified and it is removed. Okay, so this is the way we clamp and we cut, and anyhow it is vestigial organ. Only thing is, when you see histologically, it will have like lymphoid tissue, hence it is called as abdominal tonsil. Acute appendicitis. Sometimes fecal matter may get implanted into the lumen of appendix, which is called as fecolip. Okay. See, I told you appendix is also important. When you see histologically, we have lot of lymphoid tissue. Unless it is very much important, we should not go with appendectomy or appendicectomy, which is removal of appendix. Because this lymphoid tissue will be helping the intestinal visceral organs to protect against infections. Okay. So general functions, it gives good health. Okay, it gives antibodies like IgA, housekeeper of good bacteria also. Okay, so that's what we have to love our appendix. Don't be hasty to remove it. Okay, so that's all.